Okay, guys, so we're going to go ahead and get started since it's 11, and we want to welcome, oh, here's another one. Sorry, I got to admit the Zoom as I see them pop in. Can you grab that? Okay. So we are having everybody have a wonderful Saturday morning. Our talk today is going to be on an at-home stress relief technique. That's one of our tools from the NET toolbox. So NET is one of the techniques that we do that's really near and dear to my heart. I first started getting neuro-emotional technique as a patient back when I was 24, and I'm about to turn 47, so it's been a part of my life for a long time. And it's really helped me deal with just the stress, any type of stress that we experience in our daily lives from, it could be relationship stress, it could be work stress, it could be family stress, it could be your child, it could be so many different things. And a neuro-emotional technique is a wonderful way to help resolve and move through that stress so they don't become stuck patterns that can influence and cause physical issues in the body, as well as just emotional suffering. And so Dr. Chris, I'm going to let her introduce herself.
I'm Dr. Chris, and I am a physician, and I started doing acupuncture 11 years ago, and I was introduced to NET about 7 years ago. Anyway, I just started doing it 3 years ago, and it's changed my life, and especially during this time of COVID, I've been getting treatments for myself regularly, and it's helped a lot.
Absolutely. Mm-hmm. So we're both certified in neuro-emotional technique, and we will post the website for you guys too. So there's some helpful resources on the NET website, and if you perhaps for some reason don't live in locally, there is a list of certified practitioners that you might be able to find in your area. So what we want to do today though is teach you guys one of the tools that we've learned through NET that can be done at home. So to first understand some of the principles behind this technique, we're going to start with giving you a little bit of background about just a few of the things, the principles that go into the technique so that you can better understand and how it helps resolve these patterns of stress. So we're going to go back all the way to like Psychology 101, which is actually my undergraduate major in my first field of career. We're going to talk just for a moment about Pavlov. Okay, so why are we going to talk about Pavlov? Because Ivan Pavlov was he was a physiologist actually, and he did these experiments with dogs. Okay, and you guys might remember, we're just going to kind of briefly walk through that so we understand why Pavlov's classical conditioning is important to NET. So I have another one on Zoom there. Mm-hmm. So classical conditioning is this, right? So Pavlov had a dog, and he was interested in the salivary glands of the dog, right? So he had this experiment where he would give the dog a bowl of food and ring a bell. Okay, so and the dog would begin to salivate because obviously when the dog was presented with food, it's a natural reaction for salivation to start to take place. So he would do this experiment, and then what would happen is he started ringing the bell and not presenting the food, right? So the dog is hearing the sound of the bell, but there's no food being presented. Well, the dog continued to salivate just at the sound of the bell alone, okay, with no food. So what that is it's a conditioned response. So even though the stimulus, the food is not there any longer, the dog still has the conditioned response, still salivates automatically. So what happens then over time is that the more you ring the bell, but you don't present the food, okay, that response, that conditioned response should become extinguished, right? So the dog should eventually stop salivating to the sound of the bell, okay, because there's no food stimulus being presented anymore. And so this is what classical conditioning is, and this is what a conditioned response is. And so what we know about emotions is that emotional responses can be conditioned as well. So we have an emotional event in our lives, and we have a emotional reaction to it, a certain set of feelings. And what happens then is over time, if we don't resolve that original event, we don't resolve it well, right? Because remember, resolving an emotion is different than just sort of saying, oh, well,
I'm not going to think about
I'm not going to think about it anymore. I'm going to sweep it under the rug. Things we all do, suppress it, whatever. That's not the same thing as actually resolving it. Okay, so if we have these traumatic events, and they don't even have to be something, trauma differs for everyone, right? Trauma is how you experience it. We don't, need this hierarchy and say, well, your trauma is worse than mine, so I shouldn't feel bad about my stress, right? So whatever that stressful event was in the past, you have a set of emotions or feelings as a reaction to that. And then what happens is later down the road, it could be 5 years, it could be 5 months, it could be 50 years down the road, and you have an event that's similar enough feeling wise and theme wise to that original event, and your physiology will start to be worked up in the same way that it was stirred up at the time of the original event, even though these two stressful situations may seemingly have nothing to do with each other.
And you can imagine I feel more stressed out. I feel out of proportion to what this event should be causing me.
Yes.
It's because you're going back into a earlier time when you had less good coping mechanisms, or it's a stronger event. It just has the same theme.
And we know also from neuroscience that these emotional thought patterns, these emotional reactions actually hijack the neural circuitry in the frontal lobe of the brain, which is where the thinking is done. Because if we could just think our way out of a stressful situation, or think our way out of stressful feelings, or think our way out of a repetitive pattern of behavior that we don't want to do anymore. Maybe it's emotional eating, maybe it's overreacting, maybe it's whatever. If we could just think our way out of it and tell ourselves to stop doing it, no one would have any issues, right? We would just be like, well, I'm done thinking about that now, and I'm not going to feel that anymore. And we know it doesn't work that way, right? So that rational mind that does the conscious decision making, the cognitive thinking, the analysis, it literally gets hijacked by these emotions, and all rational thought goes out the window, and we keep on this loop or this train of thought, or we keep having these stressful feelings, the anxiety, the depression, the frustration, the anger even, right? And so we have to do something different to move through this so we can resolve it rather than it just looping around continuously, right?
Now the other piece of the NET process, as many of you have had it, so is the muscle testing. And the muscle testing is a way to find, it's a reflex, it's to find clues to what is bothering you. Because again, if you knew what was bothering you, you'd be able to talk about it and say, well, it's this illogical thing that's bothering me, and I'm just going to stop. This is a way to find out what really is bothering your unconscious and your subconscious self. The muscle testing is just testing whether your body is congruent with something, or okay with something, or not congruent. Something is still stuck or bothering you, or there's something out of balance, out of whack. Muscle testing is not really a yes or no question. It's not true or false. It's not what will the future bring. It's just a reflex. It's like the knee reflex. You hit the knee and the leg kicks out. It's I'm going to present a semantic clue like your mother, your father. I'm going to present an emotion like fear or dread, and I'm going to see if your body reacts. If it's reacting, then that means there's something that's triggered, like an emotional trigger.
So let's even talk about, some of people who may not know what muscle testing is, right? So it's actually like, it can be done in many forms, but the technique that we use most often in the office would be, typically we're testing the strength of the deltoid muscle against these certain semantic clues or feelings that we will say to the patient. So what we would do is actually have, So a patient would hold their arms straight out in front of them, and then the practitioner would apply like a slight downward pressure on their forearm and tell them to hold the arm strong or to resist, okay? And so there's no reason why anyone can't do that. And then we would have that person say a certain statement. We would have them think about the stressful person in their life or the stressful event, or even there's a feeling mode. So even with that, we can have them go straight to this feeling because they may not have language for it, right? And we just say, go to that feeling that you've been having, go to that feeling of stress or anger. And then we push again and the arm will go weak, okay? So that seems like, how does that work? But it's been validated in studies. There was a study published in the Journal of Perceptual Motor Skills. I think it was like all the way back in 1999 by Daniel Monti, who's a psychiatrist. We're going to talk about his study at the end of this talk. But he got involved in the NET organization, you could say, because he heard about people doing this muscle testing over 30 years ago, and he wanted to set out to disprove it, because he said this is, hocus pocus, and no one should be giving this any credence, and they're going to hurt people by doing this, right? So he designed this elaborate study, and ends up that his hypothesis was wrong, and he ends up proving the hypothesis that this is a valid way to test semantics. And ends up publishing the study, and then that's over 30 years ago, and he's been one of the main teachers in the NET organization ever since. So this seems silly, but when you actually have it done to you by a practitioner, and you can feel like there is no way I can hold my arm up against that light little pressure, and here we are, and we're able to work with men who are 6 foot and 200 pounds, and it's like, how are one of us going to actually overpower them? We can't.
Just your fingertip.
We can't overpower them. It's their strength giving way that gives us that biofeedback. It's really like a form of biofeedback, right? So we say something, they think of something, and if their body is not congruent with that, they're going to have a weakening of the strength in their system, and that can be tested with the muscle test. So NET, neuro-emotional technique, is practiced by chiropractors, acupuncturists, medical doctors, some medical doctors, and also a lot back 10 years ago, they opened it up to licensed therapists. So therapists, social workers can now practice NET as well. So you can find various practitioners in your community doing the technique. What we want to really let you know is that it really is a physiological technique. So changes are happening in the body in terms of its physiological response. If you're ever looking for a good book to read during quarantine, a book that was published a while ago, Candace Pert wrote a book called Molecules of Emotion. And she was a PhD that was, she was credited with discovering, I think, the opioid receptor back in like the 70s. And then she went on to discover all of this about how when you feel a certain emotion, whatever that is, we've learned to call that emotion, to name it. We've learned to name it anger. We've learned to name it grief, and name it, worry or whatever. But what's happening is you're actually releasing certain peptides from different organ systems in your body whenever you're feeling a specific emotion. And then those peptides are neural peptides, and they're making their way around your brain. And you are now your neocortex is interpreting those neuropeptides, and then you're labeling it and going, oh, I'm angry, right? So there's a physiological response in the body that happens when you feel specific emotions. So that's what NET really helps with, is to help change the body's physiology and restore it back to a state of balance through the NET technique. So Chris is going to tell you a couple of ways that we can get into NET and through these I'm okay statements, and so I'll let you talk a little bit about that for a moment.
Yeah, and again, if you've had NET, you remember this. It wasn't that long ago that we were doing this on everybody. So the I'm okay statement is really stands for something you want to be neutral with. So again, that event that happened when my library book got stolen, I'm okay even though my library book got stolen. It's not that you're great with it or you prefer it or you're happy about it. You just want to be neutral or okay. You want that emotional response to process and resolve.
And so, and interestingly enough, I mean, we could even use that, a relevant statement like that would be like, I'm okay with the quarantine. Yeah. I'm okay staying home. I'm okay, right? Like, I'm okay with these things, like not what anybody, I'm okay that I can't work right now. I'm okay, right? So these are like, I'm okay statements that are really pertinent to now, right? Mm-hmm. Like nobody wants to be in this situation, right? But we either have two choices. We can either get congruent with the fact that this is our current reality and have this neutral feeling of acceptance around it, right? Not preference, what Dr. Chris was saying, not preference, but a neutral state of acceptance around it, or all we're going to do is suffer, right? Because we're going to be resisting the reality of what is, and all that causes is suffering, right?
Yeah.
If I can't change the reality of what is, then I'm going to have suffering. So we can talk about I'm okay statements in that regard.
And the usual formula is you want to be okay with what is. You want to be okay even if things stay the same. And then be open to the positive. So what you desire most. You want to be okay with good things, positive things, a wonderful future, health, wellness, all those good things.
And that sounds funny. Like, why would I not be okay with that, right? But I can't tell you how many times we do test that and someone is actually not okay with the goals that they really want to have, or the future that they want, or the relationship they've been desiring. They think they want it, but there's something emotionally blocking them, and that's where NET can come in to resolve. We can also get into NET, and this can be helpful for you to do at home. We're going to teach you the actual technique in just a moment. But the emotions can cause the physiological reaction in your body too. So sometimes people have like a nagging pain, right? And maybe they are going to the chiropractor 3 times a week, but like their adjustments don't hold and they still have the neck pain, or they have irritable bowel syndrome. You know, that's well documented to have a stressful component to it. So they may be doing what they may be thinking that they're eating the right foods, right? But they still have, like, anytime they get stressed, you know, their stomach hurts, or they get issues going on in that area, right? Or their back pain. Headaches are very common. That's what got me into NET in the first place, was migraine headaches when I was 24, that no matter what I did, just wouldn't stop. And turns out there's a big emotional component to those migraine headaches. So I had to resolve the emotions before the migraine stopped, right? So all of this is ways that we can utilize the physical aspects of our body to find out where we're holding stress patterns.
We have a good question from Facebook.
Oh, we'll take a question.
Would you say suffering is equal to cognitive dissonance? And that's a really good question. That's very philosophical, actually.
Yes, but yes.
But yeah, suffering is, and it's kind of described in a way, there's your conscious self, and it wants to go this way. And then it's your subconscious, or your mammalian self, and sometimes it wants to go slightly in a different way. And then you have your unconscious, or your most primal survival self, and sometimes it wants to go like somewhere other way.
Fight or flight, often.
Right. So when you get cognitive, what's the opposite of cognitive dissonance? Everything together.
Acceptance, yeah.
Everything's together.
Congruence. It's really congruence.
That does feel the best, and that does feel like peace and calm and happiness and joy.
Yes, and when you're able to get to that point, even when it's something you don't prefer, that's what really true, like, inner peace is about.
Yeah, well-being.
So we're gonna move on to teach you the technique, and we want you to understand the 5 element associations with NET as a technique. Okay, so the lung, we have different pulses on our wrists, and we're going to touch these pulses in just a moment. And we're going to put up a reference, a chart, so that you can see which pulses correspond what we're talking about. But in Chinese medicine, each organ system has a pulse that's most where you can find the energy of that pulse on the wrist. Oh, Dr. Chris went and got a chart for us. Okay. So if you can see,
sorry,
see
Angela.
Sorry, I'm no longer visible. All right.
I think we can get that on everybody.
So that's the chart we're talking about. So the lung emotion has grief. And the grief emotion is like grief and sadness, loss of any kind, anguish, suffering. That's really what the lung energies emotion gets stuck with in Chinese medicine. The heart energy, or the fire element, gets stuck on emotions like abandoned, deserted, feeling lost, feeling insecure. Also one called frightfully overjoyed. Our patients will recognize that, right? Where you're really happy about something, but you're afraid at the same time, and that fear can hold you back. Paranoid, which we just call a misuse of the imagination, right? Paranoid is like imagining all of those what if scenarios that can go on in our minds. So if we can imagine all these bad what ifs, it's just misusing our imagination for the negative instead of the positive, right? The kidney is another organ system in Chinese medicine, and that has to do with the emotions of fear, dread, impending doom. That's always one that comes up quite frequently.
It's a heavy one.
It's a heavy one for sure. Yeah. And the liver is one of the most common in our society. That the liver energy in Chinese medicine gets blocked with anger, frustration, resentment, stubbornness, and just those kinds of depressed even, and also repressing your emotions goes into that category as well. Then we have two what's called extraordinary meridians. And one of those is called the conception vessel or the Ren vessel. And those emotions are kind of the deeper inner emotions like shame and guilt, wounded pride, like really hurt feelings, feeling like a disgrace, feeling dishonored or disrespected, a lot of those kind of deeper wound type emotions. And then it has a pair called the governing vessel, which is the Du meridian, and that's associated with emotions like false pride, we call it, and arrogance and disdain and haughtiness, loftiness, kind of these ego-ish emotions, right? So those are the emotions that we break it down to. And of course, there's many emotions and offshoots of those emotions, but typically we can categorize it into that one of those groups.
And you can imagine just her listing those, you can realize that they do feel different in your body. You can feel anger is almost like a heat, and shame is like a different kind of heat. And like there's knots in your stomach with fear and dread. So there's physical sensations to each of these, and that's all we connect with, and then you can treat it.
Yes. So in a typical in-office NET, we would start with either the body entry or the mind entry by saying, I'm okay. And then we would use these pulse points when the person's arms goes weak. We would use these pulse points to identify the specific emotion that's blocking that person from being okay with whatever it is they want to be okay with. Or we would find a category of stress, which we divide into typically 3 categories. One is anyone you've ever loved, anyone who's ever loved you. That's the world of relationships typically. And then the second category is the material world. So it could be your job, money, finances, career, those sorts of things in the material world. And then the other category is called you. So that's you in any role that you've played in the past or in the present. So your role as a physician, your role as a wife, your role as a husband, your role at work, your role as a father, right? Your role as a son, any of these types of roles. So typically we can have stress around some of these roles as well. So once we identify the emotion associated with that, the patient gets to say, okay, yes, this is how I've been having dread over my job right now. I can't work. I'm afraid I'm not going to have, enough money to support myself, whatever it might be. And we test to make sure that that's accurate. That's the beauty of muscle testing, is the person might just say the first thing that's on their mind, and it might sound very reasonable, right? But if we muscle test that, and the arm doesn't go weak, we'll say to the patient, okay, that does make sense, right? That seems to fit, but that's not what your body's testing for. So let's see if we can go a little bit deeper. What else might be there for you? What else might you be dreading about not being able to work, right? Okay. So then they would keep going until they found something, right? And so then we would say, okay, like, let's say that it's not about the finances. Let's say that their dread about not going to work is that they're going to be like looked upon. I don't know. They're going to feel, what could be another dread about not going to work?
Like you forget how to do your work.
Or yeah, you
feel like being home so much you feel like dread going back to work.
Yeah, it could be that. It could be like if you're going to feel like a failure, like you've lost your skills or something like that. You're not going to be able to advance. So they'd identify that, and then we'd say, okay, let's look back in the past for an original time in your life where there was a different situation going on, but this dread or feel of failing, like you're going to lose something you worked hard for. What could be that? And so we'll test, and we'll like go by ages, like conception to 10 and 10 to 20. And let's say that goes weak, and we keep on muscle testing, right? And let's just say, for sake of example, we land on 14. We'll say, okay, what was going on when you were 14 that you might have had a dread that made you feel like you could have lost everything you worked for, right? What was important to you at that time in your life? And let's say, top of my head, person says, you know what, I tried out for the cheerleading team and I didn't make it, and I'd spent my whole childhood doing gymnastics and I really wanted to be a cheerleader, and here I am, and everything I worked for, I didn't make it. I didn't make it. I lost it, and I never was able to be a cheerleader.
Which you can imagine would be a stronger feeling.
Yes.
Even just the memory of it could be a
stronger memory of it, right? Because it's not about how you've gotten past it today. It's about what that 14-year-old felt at the time, because their world is not as expansive as ours. They're not worried about paying bills. They're not worried about parenting. Their life is school and their friends, essentially, and their family, right? So if that was something that was so big to them, and then they lost it, they lost the opportunity, and they never got it back, that's going to have an unresolved emotion around it. So then we have them go back to that original event, and we have them feel that feeling, and then they're going to hold that specific pulse point. They're going to place their hand on their forehead and do some breath work and visualization until they feel that the energy emotionally around that particular event has sort of neutralized. So we're going to teach you a way that NET teaches us to teach you, right, of how you can mimic that at home, even though you won't be able to necessarily precisely identify the past event. You'll be surprised at what may pop up into your mind when you are in this clearing position, right?
It's a form of meditation, but you're using the three components. Posture is one of them. You want to kind of go into like a fetal
introspective, but
literally you're leaning forward,
head down, neck tuck, like you're giving your body that introspective look within you. And what you're going to do is you're going to take, if it's an area of pain, if it's a stressful feeling that you're having, and you don't even have to label the feeling, right? Because oftentimes when we try to bring our cognitive rational thought or our analysis into something, we miss it. Okay, so don't even try to label what you're feeling. And then what you'll do is you'll hold that, you'll go to that feeling, you'll be in this posture, and you're going to take, so what you're going to do is it's called the FAST technique. Let me say that first, okay, right? Sure. So NET named this the FAST technique. So FAST, they call it the first acronym for First Aid Stress Tool. Okay, so what can you do in sort of a first aid situation, right, where you can't get into the office to work with one of us or your practitioner, wherever you might be, but you need something to take the edge off, right, and help process through the emotion that you're having and help you to move those feelings more effectively through your body. So the FAST technique basically says that you're going to, at home, hold these 3 pulses on one side, and we'll show you at the demonstration in a minute, and breathe through it. And then you're going to switch hands. You're going to hold these 3 pulses on the other side and breathe through it in the same position. Dr. Chris is going to demonstrate in a minute. But the reason being is you're basically just hitting all the pulse points, right? So you're covering all the ground. Whatever emotion it is that you're feeling, or certainly more than one emotion that you're feeling, is going to be covered by touching all of the pulse points that you can on both wrists, okay? So to demonstrate that, you would take your, whichever hand you want to start with, it does not matter, okay? And the pulse points are located on the thumb side. This is the radial side of the body, okay? And so the thumb side, you're going to start with the pulse this is the wrist crease, okay? The transverse wrist crease right here. And you're going to bring your finger into that little divot just below the base of the thumb. And that's pulse point number 1. And then you're going to put your finger right next to it for number 2, right below it, and right below it for number 3. Again, doesn't matter what fingers you use, and you can put them this way so that you can turn your hand and put it straight across your forehead. The reason she's doing this, why the forehead? So the reason she's doing this is there's 2 acupuncture points located right here on the forehead. In Chinese medicine, they have to do with the emotions. Hang on one sec. I seem to be have a bad angle. Okay. Oh, maybe come this way a little bit for that group.
Oh, yeah.
Okay. So you're holding the wrist. Maybe show the pulse points one more time. Okay. Sorry, we have like 3 cameras right now. So those wrists, and right there. And so then however you want to rotate those fingers around is fine. And then why the forehead? Because there's 2 acupuncture points on the forehead that connect to emotions in Chinese medicine. So you're going to reconnect a broken circuit. Okay, what you're doing is this is representing the emotions, the physiology of the emotions that are stirred up in the body. And this is reconnecting it with the mind. So it's a body-mind technique. And you're going to tuck that head, come down into that introspective posture, kind of bend your body over a little bit, like you're really curling up and thinking about this.
And it should be supportive. You should lean onto a table or onto your lap.
Onto your lap is good.
So that you're kind of supporting. And then it's a deep belly breathe. It's just a slow, deep belly, low belly breathe.
Right. And as you're doing that, you're just allowing the feelings that you're feeling to process as you breathe. And this is the part where on either side, you're going to do that for anywhere from 20 to 90 seconds, whatever feels good to you. And please don't set a timer. Okay. Like this is organic. This is whatever feels good to you. But this is just the general, time frame that most people will hold that for. Right. And you're just letting whatever feelings come up. And then you're going to switch arms, okay, or hands, and you're going to get these 3 fingers just in the same position. So now I'm on my left hand, but the pulse points are still the same. It's always the thumb side, and then 1, 2, and 3 of your fingers right next to each other, right? So no gaps, nothing, like this, okay, right next to each other. And then however you want to wrap that around and bring it down like this, you're going to do the same on the opposite side and breathe till those feelings feel like lighter. Mm-hmm. And this is the point at which a lot of people will start to have like a random thought of like, they're 6 years old or they're 8 years old or they're 23, and they'll just be out of nowhere. They were not thinking of that event before, and then suddenly it pops up. And so then you may sort of examine that and into your inner world and be like, what is it that what is it I need to know? Show me the connection. Show me the connection between why I'm feeling that event's popping up and what I'm feeling now and how that might relate to the present, right?
And it's very common to start out feeling uncomfortable, and that's okay. That's not bad. You're not doing it wrong. Give it 20 to 90 seconds and I promise you that feeling will lift off. And that's actually good. It's it was something that needed to be released. It's like a very healing process. Meditation is healing. This is just a form of meditation using acupressure, breathing, and posture. But it definitely works to relieve the body's storage or stuck emotions.
Yes. And you can do that technique as often as you need to. And if you feel you've kind of done both sides and you still feel worked up about something, go back and do it again, right? So this time it may be like what we often find in practice here is that a patient will have one emotion come up in the beginning. And then we actually do it after they've cleared it, we test and the arm will be strong. See, in the office, we're able to validate the change in the physiology through the muscle test. So let's say that patient was thinking about 14 years old and she'd spent her whole life since she was 3 doing gymnastics just because she wanted to be a cheerleader, and then she failed and didn't get to be a cheerleader. So the arm would go weak when she first thinks about it. After processing this, and her saying, okay, I feel neutral about it, we would recheck and the arm is always strong as a rock. So the same thought and memory that just produced a weak muscle now is going and changing into a strong muscle. So what you're going to do, but then what our next step is as clinicians is we would check for any other emotion. Okay. And so it's often that another emotion comes up. So she might have dread as the initial emotion, right? But then when we test for another emotion, maybe now it goes to the deeper one of shame, right? Mm-hmm. Like what's wrong with me that I didn't make the cheerleading team? What's wrong with me? I spent my whole childhood preparing for this, and what's wrong with me? I'm not good enough, right? So now we get into we pass the dread of the lost opportunity, and now we're into the I'm not good enough feeling, the shame feeling, the deeper feelings. So if this happens while you're processing, it likely means exactly that right. You just cleared off the first layer of that, and now you need to go back through it again.
Because nobody wants that. Nobody wants to hold on to that.
Nobody wants to hold on to those not good enough feelings or whatever those deeper feelings are. Or sometimes people go, it's like, now I'm kind of pissed about it, right? Mm-hmm. Now I'm kind of angry, right? Yeah. So it could be that starts to come up for you too. And so you're just going to go back and do this process again and breathe it all the way through. It's not uncommon that sometimes even in our practice, we might have somebody have 3, 4, 5 emotions with one event, with one memory.
Lots of
so
facets.
there's a lot of layers to this. And so you're just going to keep repeating that process until you feel now more neutral, right?
And if anybody else has small children at home, mine aren't that small, but this is a technique that you can do with them as well. They use it in schools. Guidance counselors use it for kids. Just let the kids have some power over their own emotions, and you can teach your kids or grandkids how to do that as well.
It's really powerful. I mean, we always, especially if you have children who are at the age of still taking timeouts or something like that, this is something constructive that you can, or maybe even your grandchildren, right? So this is something constructive that you can teach them to do when they're in timeout, so that timeout doesn't just become like a punishment of sorts. It becomes a true it becomes a true pause for them to check in with their own feelings and learn that they can do something to help themselves with whatever they're so worked up about. Yeah. So it's very powerful to teach children this, at a young age. We have lots of kids that come into the office. I mean, we've had, toddlers, babies, all the way up through teenagers that come in for the actual NET work. But this is certainly something that can work for timeouts.
Because kids get hijacked by their emotions too.
Yes, I mean, yes. The thing with children, though, is they typically don't hang on to them like we do, right? They typically don't become stuck patterns like adults. I mean, kids are can be just angry and screaming and crying. The whole world's falling apart. And 30 minutes later, they're back playing with their toys and life is fine. It's never happened. Adults, we're not so good at that. We're not good at that. That's why we need NET, right? We hold on to things. We don't let it go as easily as children do. Okay, we're going to wrap it up. If anybody has questions, please let us know. But we have one more thing to tell you about just interesting the validation of this technique. There was a study done that took about 4 years for the study to be accomplished, but it was published in 2017 at Jefferson Medical, which is the oldest medical university in the US. So Daniel Monti is a psychiatrist and he headed the study. And so what they did is they wanted to work with a group of trauma survivors. So to have a homogenous group of experimental subjects, right? They picked cancer survivors. So the cancer survivors had to be in remission for at least 6 months. So they did not have active cancer, but they had to have a memory of what they went through with cancer that on a subjective scale of 0 to 10 stressed them out still at least a 7. Okay. So for some that might be chemotherapy. It might be the loss of their hair. It might be being sick. It might be when they actually got the diagnosis. It might be fear of recurrence. Whatever it was to them, they had to subjectively feel distressed by it. And then they had to go through a biofeedback test to make sure that when they thought about it, either their heart rate or their blood pressure changed by, I think it was 5% at least when they thought about it, indicating that it was stressing them. So they worked with a PhD psychologist at Jefferson. She was the one who actually did the NET technique with them. And what they did is they went in and they met with her and they told their story. Okay, so they told their story of their stressful event and it was recorded. Okay, so then what they did is they went and they put them under fMRI, which is functional MRI, and in real time, it's scanning their brain. Now, here's what they did though. When they're getting their brain scanned, they're listening, the patient is listening to the playback of their story. Okay, so they're hearing their story while they're getting this MRI. And they also had control groups. So a control group just was getting their brain scanned, but they were listening to a neutral story. So just something like a narrative, basically. And what they found is in the experimental group, the cancer survivors, there are certain structures in their brain that were lighting up on the MRI that are associated with memory and emotion. So the amygdala, the parahippocampus, these areas, cingulate gyrus, these were all lighting up in the brain, okay? The people who were just listening to the narrative, they were having more activity in the frontal cortex because they were trying to pay attention to the details of the story.
So it's conscious versus the emotional.
Versus the emotional, the subconscious, or the limbic brain. So that system is called the limbic system in the brain, and that is the system that was being activated in the cancer survivors when they were listening to their story. So Then the cancer survivors in the experimental group, they went back and they worked with the psychologist, and they got up to 5 sessions of NET, and they were an hour each with this particular psychologist, and they worked on that story. So they worked on neutralizing all of the emotional energy that was around that story by running the NET technique on any part of the story that was stressing them. Okay. Then they went back, right, and they had their brain re-scanned again. So they're back in the fMRI machine, and they're listening to their same story, right? Because they gave the story, they're listening to that same story. And what they found was a significant decrease and complete neutralization in many of subjects of that activity in the parahippocampus and amygdala, right? So those signalings they were seeing that were a sign of stress and emotion, that just completely neutralized, right? So that goes to show you that NET can really change the physiology of the brain, and can make these changes, and they're permanent changes. And of course, the experimental group was feeling better too. They were reporting that, these thoughts didn't feel so intrusive anymore, and these memories didn't feel so disturbing or distressing.
Yeah, they had improvement in all of the emotional and qualitative studies too. So they self-reported feeling better, sleeping better, more happiness, less anxiety.
Yes.
And it became just a story rather than reliving it or kind of re-engaging that emotional charge.
Yep.
And if you want to know more about the technique, other than all of this wonderful stuff that we just told you, they did make a documentary, and it's called Stressed, and it's on YouTube. So if you want to watch a little video of some of the other practitioners and how much they loved it, and a little bit more about the technique and looking at somebody doing it, it's all on YouTube.
Stressed, the documentary.
Mm-hmm.
Yes. Yep. Okay. So if anyone has any questions, let us know. We're going to post our video to YouTube under Indian River Acupuncture and Functional Medicine. It'll also be on our business page. If anyone out there hasn't liked Indian River Acupuncture and Functional Medicine, please do so.
I haven't liked them.
Yes, if you
like
our page on Facebook, that'd be fantastic. And anyways, we just wanted to wrap that up, and hopefully you guys will be able to use that at home, and let us know if you do have any questions about the technique. We're here. We can guide you through telehealth, or we can answer questions by email or Facebook message. So let us know if we can help you in any other way. And we're going to be back. One more thing I wanted to say. On Wednesday, we're starting our gut health series. So we're going to do, our first one will be with Chelsea Dodd, will be back with me. And we're going to do food sensitivities. And we're going to do functional medicine strategies for food sensitivities. And we're going to talk about current options for testing and treatment. And then next Saturday, we're going to do, I believe we're going to be doing detox and how to detox safely, that sort of thing. And then the following Wednesday, we're going to be doing gut microbiome and testing. And then at that point, we may go to Saturdays only, because we're going to be hopefully sort of getting back into seeing patients, honoring all the restrictions and lower volumes, but we're going to probably do them on Saturday. So we hope that if anyone's interested in gut health and really understanding how the gut microbiome affects your immune system, your brain, all of that, we're going to be talking about that. So tune in Wednesday at 4, and then we'll be back next Saturday at 11.
Mm-hmm. It was so good to see all your faces.
Yes, even virtually.
And your birds.
All right. Thank you, guys.